Astonishing stuff. New data shows cancer-related deaths in America have dropped 33% in the last 30 years. That number equates to about 4.1 million lives saved. Dr. Marty Makary is with us this morning. How did this happen? That's very good news. What need to do?
Well, the reason cancer deaths are down is that smoking is down, but certain types of cancers are going way up. The gastrointestinal cancers, colon cancer in young people under age 50. We've got a poison food supplies. We've got pesticides, ultra-processed foods, and all sorts of things that have been in the blind spots of modern medicine.
Do you put it down to that ultra-processed foods, intestinal cancer in youngsters? Is that it?
Yeah, because we've known inflammation drives cancer. And when you take all these chemicals and engineered food additives, the body reacts with a low-grade inflammatory response. You feel sick, we medicate people, but the microbiome is changing, the lining of the GI tract. Pancreatic cancer, my field of cancer, has been one where cancer rates have doubled in the last 20 years. These are the GI cancers.
Do you put that down to diet?
I put it down to what we're putting in our GI system now. It could be the pesticides are changing the bacterial lining. It could be the fluoride in the drinking water. It's probably the cumulative burden of all of these things, not one thing. Remember, we've got like 1,000 food ingredients that are banned in Europe and Canada that are routine in the United States.
I'm going to move on, but that's fascinating stuff. Excessive levels of alcohol consumption apparently increase the risk for, I think, 6 different types of cancer. But my question is, what is excessive amounts of alcohol?
Well, nobody really knows. I mean, some doctors say 1 glass is okay, but remember, 100,000 people in the United States die from alcohol abuse every year, more than fentanyl. So we talk about alcohol like it may have some benefits. If there ever were tiny benefits to the heart, they're far outweighed by the risks to the liver and the risk of abuse.
So you would have us be we don't drink, and we only eat non-processed food.
Look, I'm pro-health.
Be happy, right?
I am pro-health, so I'm going to tell you what's good for your body. I don't drink, but it's okay to have an occasional drink.
Okay, got one last one for you. We've got a new study, another new study, and it found that the U.S. health system ranked dead last in international comparisons amongst 10 peer nations. Now, this study was based on access to health care, health equity, whatever that is, administrative efficiency, and outcomes. Do you think that's a valid statement about American healthcare, dead last?
Well, look, I think we do amazing things. If you get shot or you need an emergency procedure, this is the best place in the world. But when it comes to chronic diseases, the last 50 years have been a failure in the United States. Autoimmune disease is rising. Half our nation's children are obese or overweight. A quarter have diabetes or prediabetes. Fertility is going down. Sperm counts are going down. Cancer rates have doubled for pancreatic cancer. We're seeing all these chronic diseases go in the wrong direction. Now we're seeing at least some political leadership and discussion on the bipartisan idea that we have to deal with the root causes, not just medicate people.
I want to pick up your book, Blind Spots, When Medicine Gets It Wrong. Good stuff. I'm going to read it.
Thanks. It's a lot about this stuff.
Yeah, I figure it is. Doctor, thanks for being with us this morning. That was
fascinating.
fascinating. Thank you very much.